Good afternoon, good morning, maybe good evening for all the colleagues around the world. The dear Professor Joseph Zohar, the colleagues, and all the audience online. As a director of the Peking University Institute of Mental Health and the president of the Peking University's Mental Health Hospital, also as a president of the Chinese Society of the Psychiatry. I'm honored to host this joint workshop between the Peking University and the CINP, the International College of the Neuropsychopharmacology. Yeah, the CINP is a truly worldwide organization established over the 60 years before, and also it is dedicated to promote the research and education on the worldwide basis. Recently, especially in the post-traumatic pandemic period, we have seen the increase a lot of patients, a lot of people suffered from the mental problem, also a lot of the patients in the hospital, especially for the mental disease. I think in China it happens, and also in other countries. So I believe in this time is our responsibility as psychiatrists and researchers in this field to promote mental health, as well as develop the new technology to treat and prevent the mental disease in the whole world. Today we have invite our colleagues, the distinguished Professor Joseph Zohar, to give us a great lecture with precision in psychopharmacology. Is there room for the neuroscience-based the nomenclature in clinical practice? So the professor, the Joseph Zohar, he is the chair of CINP, the International College of the Neuropsychopharmacology. He is the immediate past president of the European College of the Neuropsychopharmacology, ECMP. Currently, the Dr. Zohar, chair of International Collaboration Project, especially the joint project, joint venture of the ECMP, ACMP, CINP, and ASCINP on developing the new nomenclature for serious drugs. So Professor Joseph Zohar. So I also invite you to China, the mainland, maybe next year, 2004. We have the national conference in the April 15, and another national conference in the September 10, 2024 on mental health. In the April 15, the national conference, especially on the Association Psychiatrists of the China. In the September 10, we have the national conference on the professional, in the mental health. It's a science, the September 10, the national conference is based on science, and April 15, the national conference is focused on the Psychiatrist Association. So I welcome the Professor Joseph and the Zohar. And also, our colleagues Akada from Japan, and and also for CINP, based in Japan. Also, I have talk and discuss a lot of my colleagues in Peking University. Maybe just in my university, I think we already have more than 20 colleagues. We are attending the CINP the conference in the talk in Japan next year. For in my memory is 2000 is April, not April, is May, right?
May.
Yeah, May. Okay, yeah, May 23, 26.
Yeah.
I just we just discussed in the Vienna, in the October, first week in the World Conference on Psychiatry. Yeah, a lot of my colleagues will go to the CINP conference in Tokyo, just in my university, in my hospital. Hopefully we will get more colleagues from China. I hopefully maybe we get maybe 700 colleagues from China go to the Tokyo for CIMP conference. Yeah. So it's my pleasure to invite the Professor Zohar. Professor Joseph Zohar has published more than 300 scientific papers. Have also published a lot of the books, more than 16 books focus on the refractory depression, OCD, post-traumatic stress disorder. Also is my interesting, in the clinics, and also research on psychotropics is also a very important field. And Professor Joseph Zohar was the founding associated of Science Spectrum and also the World Journal of the Biology Psychiatry. So the Professor Joseph Zohar has considered as a world expert on OCD and PTSD, and also he's an advisor for DSM-5 and DSM-5 in OCD, and co-chair of a lot of project. For example, the sub workshop prepared on research agenda of the DSM-5. So hopefully we will see you again in the May in the Japan, and hopefully see you again maybe in April or September in China, in north of China. We conference, one is in Beijing, one is in North China. So let's welcome the Professor Joseph Zohar give us the talk. Okay, Professor Joseph.
Yeah, thank you. Thank you very much, Lynn, for this kind introduction. We really appreciate this. Let me take 1 minute from your time before we start, introduce Susie, the executive manager of CINP, and she will talk to you about some initiative that we got in order to encourage more Chinese participants to attend the Tokyo meeting. Susie?
Yes, thank you, Yossi. Absolutely. We are keen that as many as possible of you are able to come to Tokyo. And what we're offering is the possibility to win free registration. There are no catches, it's very simple. If you simply send an email with the heading Tokyo Prize Draw, and I will send this to Yankun Sun again, so she can distribute it to everybody who's attended here today. But if you send an email with the heading Tokyo Prize Draw to info@cinp.org, then one or two, depending on the numbers of entrants, one or two lucky people will have free registration, free of charge, to attend our event in Tokyo in May. So please write to us, and we look forward to seeing as many as possible of you there.
Thank you, Susie. So let's start the talk, and I'm going to share the screen. So basically, the subject of the talk is about precision in psychopharmacology. And is there a room for neuroscience-based nomenclature in the clinical practice and guideline? And actually, if you think about it, all start from Confucius in a way. The beginning of wisdom is to call things by the proper name. so this is basically what we are doing. And let me start with the current nomenclature. The current nomenclature is indication-based. And as you can see, it is basically, we talk about antidepressant, we talk about antipsychotic, anxiolytic, hypnotics, mood stabilizer. This is the basic names that we are giving to the medication based on the disease. However, the current naming, the current nomenclature of psychiatric medication is confusing for the patient. We often prescribe antidepressant for anxiety disorders or second-generation antipsychotic, so-called second-generation antipsychotic, to depressed patients who show no evidence of psychosis. So I'm sure that you often encounter the situation that the patient, anxious patient, is telling you, why are you giving me antidepressant for my anxiety? It must be confusing for the patient to find that anxiety disorder is being treated with antidepressant. The situation is even worse in depression. Many times we give dopamine blockers, what we call antipsychotic, in order to augment the effect. But for the patient, his perception is my condition so bad that you're giving me antipsychotic? It is horrifying to find that your depression is being treated with antipsychotic. And of course, this has implication on adherence. The patient and the family don't understand why they are getting antidepressant for anxiety or antipsychotic, so-called antipsychotic for depression. It has clinical consequences regarding the adherence, which is a major issue in psychiatry. What about nomenclature in other fields in medicine? Let's say when we talk about our colleagues who are treating hypertension, their nomenclature is based on mechanism. So our colleagues who treat hypertension, their nomenclature composed of diuretics, beta receptor blocker, calcium antagonist, AC inhibitor, angiotensin II antagonist. And when they are considering to augment, then they can use the nomenclature and choose medication that act on different mechanisms. So in hypertension, let's say, the nomenclature serves as a tool which helps the clinician to make informed decision. So if they would like to augment, then they will, let's say, if the patient is getting diuretics and they would like to augment the effect, they will choose based on the nomenclature medication from with other mechanism. Another problem in our current nomenclature is that it doesn't reflect the current scientific knowledge. We were all very happy and proud that a Nobel Prize has been given to Carlson, was at CINP, Paul Gringard and Eric Kendall for the discovery of our monoamine system and psychiatric drugs functioning in the brain. And so all of this is really major advance in our understanding of the biology, of the neurobiology of how psychiatric drugs functioning in the brain. The point is that looking at the current nomenclature, it does not reflect those advances. If we talk about antidepressant, antipsychotic, anxiolytic, and so on, there is nothing about the monoamine system there. Another issue is that if we think about it, this is actually 60 years old disease-based nomenclature that has not been updated in the last 60 years, which is in a way strange. You know, we are doing a lot of updates in psychiatry, moving from DSM-2 to DSM-3 to DSM-4, then to DSM-5, moving from ICD, 9 to 10 to 11. But we have not done so in regard to psychotropics, to medication that we use in psychiatry. What is our expectation from psychotropic nomenclature? We expect this to be based on contemporary knowledge, to help clinicians to make informed choices when they're working out the next pharmacological step, to provide system that does not conflict with the use of medication, i.e. no more antidepressant for anxiety or antipsychotic for depression, and be future-proof and accommodate new types of compound. If you think about our current nomenclature, none of them are true for our current nomenclature. This current medication, it became clear that we need to update it. And the idea is that since it does not reflect the contemporary knowledge, nor does it appropriately inform the clinician about rational prescribing, that it needs to be updated. And in order to update this, 4 international colleges of neuropharmacology with expertise in this field joined together. This includes the European College, the American College, the ASEAN College, and the CINP, the International College. And they decided about 15 years ago to join forces and to come up with better way to classify and also include the UFAR, International Union of Basic Clinical Pharmacology. So these 4 neuropsychopharmacology colleges with the International Union of Basic and Clinical Pharmacology joined forces together in 2008. This is the list of the task force of individuals who participate in this event. And the mission is the following. To help clinicians, the mission that was assigned to this group was to help clinicians to make informed choices when they are trying to figure out what would be the next pharmacological step. Also, to decrease the stigma and enhance adherence by a naming system that lays out the rationale for selecting a specific psychotropic. This was the mission. the proposal of this task force, composed of these 5 international organizations, was to move from indication-based to pharmacologically driven nomenclature. Pharmacologically driven nomenclature that embeds contemporary neuroscience understanding of how medicine actually works. So this is the main point. No more indication-based, moving to pharmacologically driven. Let me show you a short clip about this. So basically, as we saw in this clip, the basis of the nomenclature is based on pharmacology and mode of action. So now we look as the task force on medication that works in of psychotropics used worldwide. And looking at the entire list of medication used, most of them, vast majority, we came up with 147 compounds. I think it's about 150 compounds. If we look at the total number of psychotropics that are used worldwide. So now in this 147, we look at the pharmacology. So basically, each time that you are prescribing one of the 147 medications that are available now worldwide, if you prescribe this medication, you basically touch upon pharmacological target. And we look at the entire pharmacological target that are being affected while we give them medication. So this is the first part of the nomenclature, looking at the different pharmacologically target across all the medication or the vast majority of medications that are used worldwide. And if we look at this, we basically found 10 pharmacological domains. Acetylcholine, dopamine, GABA, glutamate, histamine, orexin, melatonin, norepinephrine, opioid, and serotonin. So basically, at this point of time, and as the science and the as the science is moving on, we can find more. But at this point, each time that we are prescribing any psychotropics, we touch upon one of these 10 pharmacological domains. And we also then, in the pharmacological domain, we are doing some sort of activation. What is the mode of action? Again, among all the 147 psychotropics that we examined, so basically we found 9 mechanisms of action. Receptor agonist, receptor partial agonist, antagonist, reuptake inhibitor, releaser, enzyme inhibitor, ion channel blocker, positive, allosteric modulation, PAM, and enzyme modulators. So basically the point is that each time that we are prescribing any medication to our patient, we tap upon one of the 10 pharmacological domain, and then we are affecting, and then they are affected via one of these 9 mechanisms of action. And if you think about it, it helps us to expand our vocabulary. So no more limiting our vocabulary when we talk about psychotropics to 7 words: antidepressant, antipsychotic, anxiolytic, hypnotic, mood stabilizer, and stimulants. It helps us to increase and to be more precise in our vocabulary. So basically, NBN, neuroscience-based nomenclature, encourage us and allow us to use different words, more concepts when thinking and describing our treatment, when talking among ourselves, when thinking about the next pharmacological step, and when talking with the patient. So basically, based on NBN, how many different groups of drugs we refer to, how many different types of medication we actually got if we look at the entire list of 147 medication. We got a little bit more than 60 different groups of drugs, different in regard to their pharmacology and or mode of action. So basically what we need to remind ourselves that each time when we are seeing a patient and we decide about how to prescribe medication, we need to make sure that we need to be aware that we got 60 different groups of drugs to work with, and we need to pick the right medication for the patient. And this is how the app that was mentioned in the clip, and I will talk about it later, is going to help us to choose the right medication, one out of the 60 different group of drugs. And also it clarified the rationale for choosing certain medication. And because we have better vocabulary, more tools, it helps us to move the field toward precise medicine. So now if you think about our expectation for psychotropic nomenclature, that what is the expectation? Be based on contemporary knowledge, help clinicians to make informed choices when they're working out the next pharmacological step, provide a system that does not conflict with the use of medication, and be future-proof and accommodate a new type of compound. And if you think along this line, all of them are true for neuroscience-based nomenclature. Just let me give you another taste of what we are talking about. This is the glossary. So instead of talking about disease-based, indication-based, we talk about dopamine blockers, dopamine partial agonists, dopamine enhancer. Dopamine blockers would be something that is going to replace basically the what we used to call antipsychotic. We talk about monoamine enhancer, which is sort of replacing to some extent what we used to call antidepressant. We talk about monoamine blockers, monoamine modulators, norepinephrine blockers, serotonin blocker. Again, some of them are going to be part of what we used to call antidepressant, and I will talk about this in a couple of minutes. GABA enhancer, which basically going to replace the old term benzodiazepine, glutamate blockers, glutamate enhancer, cation channel blocker, which to some extent replace what we used to call mood stabilizers, and lithium. So this is basically, if you think about it, we are moving now to different language, but the language is not very complicated. The language is basically composed of the monoamine and either blockers, enhancer, or modulators. And in this sense, really represent the advantages that we have been going through in the last several years and reflect our current understanding of the neuroscience beyond the treatment that we are giving. So let's say one of the propose of guidelines is to improve the treatment, right? We are doing guidelines, and every time when we see patient, we think how we can improve the treatment for the patient. And expanding our vocabulary would help us to be more precise while treating our depression. Let me give you one example for thinking about what we used to call antidepressant, and now we call it monoamine enhancer or other names. We'll see it in a minute. So basically, each time that you're seeing depressed patient, how many different tools, how many different medication you could choose from in order to treat the patient that you're seeing? 16. Let me show you. So this is, again, if we are moving from the old disease-based nomenclature, the new nomenclature, we see that we got 16 different type of medication to choose from and to make sure, and our goal or desire is to make sure that we are finding the best medication for the patient that we are seeing out of the 16 different tools that we got in our hand that enable us to treat depression. So here is the list, and you can find it in the app. You can find it. I will later share with you the website. All the information here you can find in the website there. Again, this is part of the medication, include this list and include this list of medication. And as I mentioned, there is a website in which you can find all the information that I talk about. It's www.nbn.science, and it includes NBN, which I mentioned. It includes also NBN-CA. We have specific application for NBN child and adolescents, and I will show it to you later in a minute. And we got and we got also, which is not yet operated, but it will be soon available, NBN-PF, NBN for patient and family. And all of them are included in this one domain. Okay, so now let's talk a little bit about the NBN app. This is how it looks like. It is free of charge, mobile platform, and this is, so it should be, it's available. And the point about the app is that we keep updating it. So it's not like a book that what you read there is something that is true, like what was going on 2 or 3 years ago. We keep updating it every year. This is the, we talk about the, we mentioned the clip about the NBN, the app for NBN neuroscience, and we saw it. Now let's see the clip for NBN patient, child and adolescent. Just a minute. So basically, we got on top of the NBN, which is for adult, we got the NBN for child and adolescent. As I mentioned, later on during this year, we'll have another application for patient and family, which explain in a lay language the medication that they are getting. So basically, the idea is that if you prescribe a medication for a patient, you can give him a print or send him to the right location in the web, explanation about the medication that use the terminology that we are using, i.e. focusing on pharmacology instead of disease-based. As I mentioned, it is free of charge, and it can be used everywhere. Basically, let me share with you again, step by step, how it actually works. So let's say once you download it, you get this screen. The primary search is the blue area, and secondary search is black area. And in the black area, you got these 6 buttons. Now, let's say that you start your research by typing on the blue area. Let's take an example. Let's say that you have a depressed patient and you'd like to know which drugs are useful in depression. So basically, you click depression in the blue area, and then you get all the list of medications that work for depression. Now, let's say the patient suffers from sexual side effect because of the serotonergic component in the medication that you are giving him, and you would like to switch him from serotonergic medication to noradrenergic medication. Then what you do is you tap in the black area, you add axis search, and then tap of the bottom pharmacology and type norepinephrine. And then all the drugs that are effective in depression and work via noradrenergic system will be listed. So you see you got in the blue the depression, and then you add another layer, which is noradrenergic, the pharmacology, the noradrenergic, and then you get the list that compose of all the medications that work for depression via the noradrenergic system. Now, because as I mentioned, the drug was complaining about sexual side effect, you'd like to do more precise and find out which of these medications that work for depression via noradrenergic system would have the less sexual side effect. So what you do, again, you push on the add search axis, and then you push on efficacy and side effect, and you type sexual side effect. So basically, now you got composition via the search engine of individual who suffer from depression that will get noradrenergic medication that works for depression and have low sexual dysfunction side effect. And here you get the list of this medication. And then let's say you choose reboxetine. You choose, so basically you look at the list of medication, you choose one of the medication, you choose reboxetine, you tap on reboxetine, and you get the entire profile of reboxetine. Pharmacology, norepinephrine, mode of action reuptake inhibitor, in indication major depressive, efficacy improve symptom of depression. Side effect, urinary elicitation may produce tachycardia. Practical note, low probability of sexual dysfunction. There is another thing that you can do. If you look at the upper right of this, you see the eye. You can tap on this, and then you discover another cool feature, sweep to the left for similar drugs. So basically what you can do now is look for sweep to the left, and then you get medication that have the same pharmacology and mode of action, and then you can look at the different medication with the same pharmacology and mode of action and try to do another fine-tuning for the medication that you're choosing for the patient by giving them the right medication. On the upper side of the page, you got this sign, and if you push there, you get the information, some of the information that I mentioned. You can look at this and find out what is needed, more explanation about this and all of this. What is the most important part for us is this one, send feedback. We keep improving the system based on the feedback that we are getting from the people who are using it. Last point, the app works online and offline, and if you got stuck, it might happen. Restart the app again. Still does not work, turn on airplane mode and try again. So download is on Google or iTunes App Store. So far, if we look at the total number of downloads, it's more than 100,000 that download it across the globe. And this is true for 5 months ago. And as you can see, there is steady increase in the number of individuals who are downloading it. Let me conclude. The current nomenclature is indication-based, and it includes, as all of us know, it includes what we call antidepressant, antipsychotic, anxiolytic, hypnotic, mood stabilizer, stimulant, and so on. But it is confusing for the patient. Going back to why are you giving me antidepressant for my anxiety? Or is my condition so bad that you are giving me antipsychotic? Also, it does not reflect our current understanding of the monoamine system and how the monoamine system works in psychiatric drugs functioning in the brain. And because of this collaboration of these 4 international organization, led to the suggestion that we should move from disease-based, indication-based to pharmacologically driven nomenclature that embeds contemporary neuroscience understanding of how medicine works. And accordingly, we identify 10 pharmacological domain and 9 mode of action in the medication that we are currently using. And based on this, we built this new glossary, which composed of the monoamine understanding. And for the mode of action, we limited it to blocker, enhancer, and modulators. And accordingly, as you can see, we got this list of medication that if we use this, it would be more scientifically sound and would help us to communicate better and to make more rational pharmacological steps while we're thinking, while we're prescribing for the patient. Because it helps us to expand our vocabulary and help us to be precise while we're treating our patient. So, and we give an example when we talk about so-called antidepressant, it's not one group, it's actually composed of 16 different groups. And this is one example. We have the same type of example for what we used to call antipsychotic and related to the marketing issue of first and second generation and so on. And basically, as I mentioned, each time that we are seeing a patient, we are prescribing something, we need to choose one tool out of the 60 different groups of drugs to work with. And in this regard, the app can help you. And this is why I think that there is a room for neuroscience-based nomenclature in the clinical practice and in the guideline. We started with, and you can find everything in the website that you can see here. You can find about NBN, NBN-CA, and NBN child and adolescent, and NBN patient and family, which is still, we are still working on this, but it will be ready, and you are very welcome to look at the website. And of course, very welcome to download the free app and start to play with this and use it. And please make sure that if you find something that needs our attention, to send us some feedback. And if you do so, you're going to join more than 100,000 psychiatrists worldwide that download the app. Let me finish with something from Chinese poem. They talk about us, the doctors, as be scientists in our minds and artists in our arts. And I believe that NBN would help us to be better on the scientific part. Thank you for your attention. And now I will ask Kazu to take or if you have any question, it depends if it's possible.
Thank you so much, Professor Zohar. It's really nice to have your lecture. Actually, I think the NBN is a quite useful app for medical doctors, for our psychiatrists, even for students, to get to know more about the drug, the medicine used for different kind of diseases, mental disorders. So can we transfer to Professor Akita to introduce more about the CINP in Tokyo?
Yes. Thank you very much.
Thank you so much.
Yeah, thank you very much for giving me this opportunity. So I'd like to show you the slides. Okay, so hello everyone. I'm Kazutaka Ikeda, the president-elect of CINP, and also I'm serving as the chair of the local organizing committee for Tokyo Congress of CINP. And also I am a former president of ACNP, Asian College of Neuropsychopharmacology. As you may know, the current president of ACNP is Professor Tianmei Si in Peking University. And I'm also a former president of JSNP, Japanese Society of Neuropsychopharmacology. And I'm I'm playing several roles in these organizations. So I'd like to introduce CINP more, although Professor Lu kindly introduced CINP at the beginning. The CINP is the International College of Neuropsychopharmacology. CINP is a truly worldwide organization established over 65 years ago in Zurich, Switzerland, and can count on widespread support from all over the world by its active members. Holding regular meetings in forms of training, educational programs, international meetings, and world congresses, CINP reaches interested researchers all over the world. Clinicians hear about the latest research advances and new treatment fields. Researchers hear about new clinical needs and problems. Therefore, CINP is dedicated to promoting research and education on worldwide basis. So, as you know, innovation in psychiatric therapy, innovation in psychiatric therapeutics occurred in 1950s. So anti-psychotic effect of chlorpromazine was found, and antidepressant effect of imipramine was found in these days, and in those days. So at that time, CINP was established to develop new medications and also to use these medications properly, and also to review the mechanisms underlying the actions of medications. So CINP was established in 1957, and this shows the representative presidents of CINP. So the 11th president, who was Professor Arvid Carlson, as Yossi introduced in his lecture. He was the president of CINP, and he was the Nobel Prize laureate. And the next president was Professor Dr. Ko Jansen. He established Janssen Pharma. So CINP was led by these leaders in academia and also industry. So this shows the current board members of CINP. So as you know, the Yossi is the current president, Professor Joseph Zohar from Israel, and I'm the president-elect from Japan, and the past president is Professor Pierre Briel, and there are two famous vice presidents and secretary and treasurer, and there are 10 counselors, and Professor Tian Messi is one of our counselors. And next year, we will hold CINP 2024 World Congress in Tokyo. So from May 23rd to 26th at Tokyo International Forum. This venue is very close to Tokyo Station, so it's really the center of Tokyo. And the theme is New Wave of Neuropsychopharmacology Toward Well-Being. And this World Congress will be held together with JSNP, JSCNP joint meeting. JSNP is Japanese Society of Neuropsychopharmacology, and JSCNP is Japanese Society of Clinical Neuropsychopharmacology. So this is the timetable of the World Congress. So on the first day, May 23rd, workshop, industry lunch seminar, opening and award ceremony, plenary lecture, opening remarks, industry symposium, and welcome reception. on the second day and third day, the program is similar. So industry breakfast symposium, plenary lecture, symposium, industry lunch symposium, special session, oral session, plenary lecture, and poster session. And in the on the third day, there is dinner cruise, so Tokyo Bay cruise. And on the last day, May 26th, industry breakfast symposium, plenary lecture symposium, industry lunch symposium, poster session, oral session, plenary lecture, closing remarks, and farewell party. So this shows the plenary lecturers at the CINP 2024 Tokyo Congress. So Professor Virginia Mann Lee is Nobel Prize candidate, and Professor Joshua Gordon, he is the director of NIMH, National Institute of Mental Health in the United States. And Dr. Haruo Naito, he is the CEO of Eisai, and as you know, Eisai developed lecanemab recently. And Professor Fleisch Hacker, he is the president of Medical University in Innsbruck. And Professor Belinda Lennox is the head of Department of Psychiatry in University of Oxford. And Professor George Koob, he is the director of NIAAA. So there are distinguished researchers lectures. And we have 25 symposia from 88 proposals, and more than 600 oral poster presentations, and already more than 28 industry seminar and symposia were planned. And there are social events, so opening reception, dinner cruise, and farewell party. The important dates, late-breaking abstracts. Submission deadline is January 12th next year, and early bird registration deadline is also January 12th. And late-breaking abstract acceptance notification is January 31st. And regular online registration deadline is May 10th, and the day of CINP 2024 is May 23rd to 26th. So this year we held the Montreal World Congress in Montreal, and next year we will hold in Tokyo, and in 2025 we will hold CINP World Congress in Melbourne together with ACNP, Asian College of Neuropsychopharmacology. And in 2026 we will hold CINP World Congress in Glasgow. So I'd like you to participate in all of these CINP World Congresses. So Tokyo from May 23rd to 26th next year, and Melbourne June 15th to 18th in 2025, and Glasgow June 26th to 29th in 2026. Okay, so that's all. Thank you very much for your kind attention.
Thank you so much for Professor Akida. And that's quite impressive that we're going to have a global meeting in Tokyo. Actually, Professor Liu and some of our colleagues may come to the meeting. And as well, we can see lots of distinguished guest speakers actually will do the keynote speech at this meeting. So hopefully we can have a wonderful congress post-pandemic time in Tokyo. Thank you so much. And we will share the information through the Chinese Society of Psychiatry to we will share the information of the CINP Congress the Chinese Society of Psychiatry to encourage more scholars, more researchers, and psychiatrists to join the meeting, and as well as like a kind of expanding the collaboration between Chinese Society of Psychiatry and CINP, which is the distinguished foundation or like a college in psychiatry and neuroscience. Hopefully, we can get more collaborations, not only with the Congress, but also have some in-depth research collaborations between China and the worldwide scholars. Thank you so much for wonderful lecture and promotion from the lecture from Professor Zohar, and wonderful promotion from Professor Akita. Thank you so much. And Professor Lu actually leaving for some other meeting. So one more thing that actually this lecture will be in series. So next lecture will be held in January 2024. Hopefully we can have more. We can have the audience here in domestically in China. Thank you so much. Also we may have some lecture, some audience from globally.
Yep.
Thank you so much. Thank you so
Thank
much,
you.
Professor Han and Professor Akita. Thank you so
Thank you
much.
very much.
Thank you for arranging this. Bye-bye.
Bye.
Thank
Have a nice
you.
day.
Bye.
Bye.
Bye.